October is Breast Cancer Awareness Month, and a new report says it's becoming more common in women under 50. The American Cancer Society says this could be because of factors like environmental exposure, food, air, water, and obesity rates. The increase in breast cancer is happening at a time that breast reductions are becoming more common.
That's right. And 9 News medical expert Dr. Payal Kohli joins us now. So first of all, breast reductions, is it something that could impact your risk for breast cancer?
It can reduce your risk for breast cancer. Now, this is not a reason to go out and get a breast reduction, but what they find is that the risk reduction is proportional to the amount of breast tissue removed, which sort of makes sense. If there's less breast there, there's less risk of breast cancer. In fact, even your age at the reduction, so older women over the age of 40 who get a breast reduction have a lower risk of breast cancer than if you were to get it at a younger age.
I do want to talk about the intent of people getting breast reductions because they're going up. And full disclosure, I've had one and they grew back. So there's that after having a second child. But I mean, that kind of happens, right?
It completely happens. And I'm so glad you brought this up, Alex, because it's all over social media. In fact, we're seeing such a large increase, a 64% increase in people wanting reduction mammoplasty or breast reductions, and the highest increases in people under 30. And it's because I feel like we as women are always at odds with our body, and we're always thinking about what society says. And, you know, big brows are in, thin brows are in, big breasts are in, now small breasts are in. So now we have to keep adapting what we're doing. And so cosmetic reasons to get breast reductions are really not a good idea. Now, if you're doing it for other medical reasons, that's a completely different thing. But I really want to caution people about just following the trend. And all the plastic surgeons out there are saying that the #1 reason young women are coming to them is because they're seeing it on social media and they think that it's the right thing, the trendy thing to do.
Right, that's alarming. Talk to us, you brought up the medical purpose for it. So what are some of the symptoms someone might have who would want to get, and we could ask you this too, who may want to get a breast reduction?
Right, I mean, there's really good medical reasons to get it. So the most common is kind of chronic neck, back, or shoulder pain. You think about the waist, the pendulous breasts, they put abnormal forces on your neck and your shoulders, and you can have chronic problems, not just with your posture, but with neck issues. So that's a common reason. Another is skin irritation. So a lot of women actually get chapping under the breasts if they have large breasts. You can get yeast infections under there, so it can actually cause problems. And then finally, I hear this a lot as well from my patients, the bra strap digs in because it's holding up so much weight.
I have scars, like literally scars in my shoulders from bra straps. But I've had, I mean, you know, since I was like 13 years old.
So was that part of your reason?
It was,
Alex?
but I'm not going to lie. It was a combination of both things.
Right.
It was partly cosmetic, and I'm not going to be shamed into feeling like, you know, I want to look my best and just I want my clothes to fit better. I want to look better on television. So yes, it was partly cosmetic, and I own that very proudly.
Good for you.
But it also was a physical ailment. Like I hunch over. I have bad posture because of it. Like
you talk about clothes fitting, that's not entirely cosmetic either, because a lot of women struggle with that. Their clothes can't fit. They feel uncomfortable wearing a blouse, and they feel like they can't breathe as well because it's too tight for them on the chest.
And not to mention, I mean, societal norms, right? Like women do get catcalled and treated differently when they have larger breasts. That's something that, you know, I never had to deal with, but I can't imagine. So I can't imagine the psychological effect, of course, the physical effect, and then the effect that you talked about of just wanting to feel comfortable in your own skin.
And that's so huge.
So important. And our self-esteem is so tied to how we look and how we feel. And both of these are impacted when you have very large breasts. And so thinking about a reduction mammoplasty is not an unreasonable thing if you feel like those are bothering you on a day-to-day basis.
And something I want to talk about, because it was a question that I had and I had to talk to my doctor about because I had one child, breast reduction, second child, and breastfeeding was not an option for me because of the reduction on the second time.
And it's very true, because you remove that breast tissue, you disrupt those ducts, you know, the mammary ducts that provide the milk. So you're 3 times as likely to be unable to breastfeed after having a breast reduction. So that's certainly a consideration, especially if you're thinking about doing it young, before you've had those children or thought about having those children, because down the line, that's not a reversible thing. It's not something that you can take back.
If you do it young, do you run the risk of them growing back though?
And
or is it only because of after a child?
It's an interesting question, but it has to do a lot with hormones. And so our breasts change throughout our life as a result of our reproductive life cycle, right? We have menstruation, and then we have pregnancies, and then we have menopause. And each of those events can actually trigger changes in our breast size. Our weight can trigger changes in our breast size. So now we've talked about all these weight loss medications. A lot of women are actually coming in losing the weight off their breast naturally without having to think about reduction.
Interesting.
Because our breasts are made up of tissue and of fat. So our breasts do evolve naturally over time depending on our weight and our hormones, but certainly it's something that can change. So you could have had a reduction like Alex did and then have to think about potentially another one later in life.
That's what I'm doing right now in my life. So it's just like, did I do it too soon? But the lessons you learn, honestly.
Yeah, no, I wouldn't second guess yourself, Alex. I don't think you did it too soon, but I think the body changes over time, and sharing your experience has been really empowering. But again, it sounds like you did it for a lot of medical reasons as well.
Well said.
Yeah.
Thank you for being so
Thank you.
transparent,
Yeah, of
Alex.
course,
Thank you,
always.
Dr. Coley.